Hello and welcome to this edition of Extension Ed Talks. I'm Erin Petersilie and I'm the Family and Consumer Science Extension Agent for the Walnut Creek District, which serves Rush, Ness, and Lane counties here in the northwest part of Kansas. Today we are going to focus specifically on Medicare Part D. It is the newest portion that we have to Medicare, and this is our prescription drug benefits when we talk about Medicare Part D. We need to remember that there are four parts to Medicare. Medicare Part A and B are considered the original parts of Medicare. This is what Lyndon B. Johnson signed into law in 1965, and they take care of the hospital and the medical side of insurance. And then along came Medicare Part C, which is our Medicare Advantage and Medicare Supplement plans, and they simply fill in the gaps that Medicare does not take care of. And then we have the newest part that is Medicare Part D, which is our prescription drug insurance. Something that we need to remember before we get too wrapped up in what prescription drug coverage is, we need to remember that Medicare is only going to pay for things that it considers necessary. And so then the conversation then comes to, well, where does Viagra fall into this mix? Medicare says that Viagra is not medically necessary, so you are not going to find a plan that pays for it. You need to understand that if this is a medication that you need to take, that it is going to be out of your own pocket, that Medicare will not take care of it. So when we look at Medicare Part D and that prescription drug coverage, you must at least have Part A to start with drug coverage and or Part B. You must live within the planned service area. We don't want you buying something that you aren't going to be able to use. You cannot live outside of the United States. This does not mean that you can't go and visit outside of the United States. This just means that your permanent address is not outside of the United States. You are not allowed to be incarcerated and be on a Plan D. And you must enroll in Medicare Part D to avoid the penalty. In most cases, this enrollment is not automatic, and unless you have credible coverage, then you would need a Medicare Part D. So I'm going to give you a couple examples here. Let's say I am 65 years old, I'm continuing to work, my employer provides me with medical insurance and it provides me with what is considered credible drug coverage. And I will get a letter that states that. It will say that the plan that you are on is considered credible by Medicare. Simply keep that piece of paper. You may need it later on when you do go to enroll and have to prove that you've been on credible coverage. So as long as I have that credible coverage, I am not going to need to enroll in Part D. Now, if my enrollment status changes or my livelihood changes, maybe I decide to retire, or maybe my employer no longer offers a plan that's considered credible, then I need to go into Part D. I made a comment about there being a penalty. So let's say that I have retired at age 65 and I just didn't want to pick up Part D. Maybe I didn't know that I needed to, or maybe I just didn't want to. Whatever the reason is, Medicare is going to charge you a penalty for every month you should have been enrolled in Part D and weren't. And that penalty amount can change year to year. It's based on the base premium price of the plans that are being offered. So right now, the penalty is 33 cents per month. So if I go for 1 year without having Part D and I should have been on Part D, I'm going to pay 33 cents per month. So that's going to be about $4. They're going to charge me that $4 on top of my premium amount for every month. Okay, so that penalty amount can really add up. And I don't know about you, but I don't like paying penalties. So please go ahead and make sure that we make, again, the right decisions at the right time so we can avoid those penalties. And okay, so when we enroll in Part D, you can join during that 7-month enrollment period, 3 months before you turn 65, the month you turn 65, and 3 months after. Now, one of the little quirks to Medicare is that if you are blessed with a birthday the first day of the month, your Medicare will begin the month prior. So if you are a January 1st birthday, like my sister is, her Medicare will actually start December 1st. So just one of those little quirks that we have with Medicare. Medicare Part D, I want you to think of as a dance. Okay, you can change your partner. Okay, we can change our coverage every year. So this is something that's very unique with this side of things. And we can change that every year from October 15th to December 7th. It doesn't matter what days of the week it falls on. We need to make sure that we know that our enrollment period is October 15th to December 7th every single year. And then that coverage will begin January 1st. Again, you can enroll at special times. So if you retire mid-year or if you end up getting extra help, you will get some special enrollment times with that as well. So the first question that we have to ask ourselves is, should I enroll in a Part D plan? Well, do you have credible coverage? And credible coverage meaning, is it as good or better than Medicare? Will that coverage end when you retire? There are some employers who will continue that coverage, so you may not need to have a drug plan. It's not needed if you do have a prescription drug plan that is considered credible by Medicare. It's best to enroll in the cheapest plan if you're taking no medications, and understand that this could be a separate policy than your Medigap policy. So when we go to choose one of these plans, we need to compare premium, we need to compare the drug prices, the deductible, co-insurance, whether or not there is gap coverage or what the gap coverage is when we hit the donut hole. And then does it include things with step therapy, prior authorization, are there quantity limits on medications? All of those things can play into effect of how we're going to choose what plan we want. Again, October 15th to December 7th is when we are going to be able to check and see what our plans are for the 2017 year and begin in that enrollment. You can do enrollment by calling or by computer. You can go online to www.medicare.gov. You can call a SHIC counselor, which is a senior health insurance counselor for Kansans. I didn't explain what that was earlier. Many of us extension agents are SHIC counselors, as well as there are many community members across the state of Kansas. And we have all taken a training to help people educate and understand and walk them through the Medicare system. We can also help people enroll in Part D, so you can actually come into our offices and we can help you do this. You need to understand that when you are working with a SHIC counselor that you are going to receive free, unbiased educational resources that when we do this. So we can't sell insurance. We're not looking out for their bottom dollar. We're looking out for you as a consumer and want to make sure that you are educated to be able to make the best choice possible. So to join, we've talked about being able to call a SHIC counselor. You can also call the plan. You can enroll on the plan's website or directly through medicare.gov. You can also call 1-800-MEDICARE and have them walk you through the plans. When we come back, we are actually going to spend some time enrolling in Medicare and walking through how we would use the website and what that process looks like.
The plumber said there's something wrong with my water. It looks like you have hard water. You need a water softener. Let me show you the options we have. Hey, do you guys deliver salt? We sure do. What about drinking water? We have water coolers and drinking water systems. We even have bottled water.
Find us on Facebook and itsbetterwater.com. And remember,
it's not just water, it's better water!
The easiest way for you to get anywhere in the country is the Hayes Regional Airport. Twice daily flights between Hayes and Denver means you are only 45 minutes from over 100 direct flights to get you to your destination as quick as possible. Service from SkyWest has completely changed the flight experience out of Hayes thanks to the 50-passenger jets that include complimentary beverages and an in-flight restroom. With free parking and short security lines, there has never been a better time to use the Hayes Regional Airport. The next time you travel, check Hayes first at flyhays.com to see the time and money you could save.
Make moving and storing your home or business easy with storage solutions of Hayes and Victoria. With 2 facilities, they can store anything from antiques to automobiles and everything in between. Interior units for items needing special care. Drive-up units of all sizes, perfect for home or business. And outside storage for trucks, boats, and RVs. As an authorized U-Haul dealer, they have everything for your next move, across town or across the country. Storage solutions of Hayes and Victoria, making moving and storing easy.
Western Auction and Real Estate LLC is ready to travel to you. Their team includes auctioneers and real estate specialists that will exceed your expectations. They offer experience in agriculture real estate, commercial and residential sales, and farm equipment auctions. Plus, they conveniently travel to your location. And it doesn't stop there. Visit westernauctionandrealestate.com today to shop their online equipment auctions too. For professionalism from concept to completion, it's Western Auction and Real Estate.
Welcome back. As we've talked about Medicare Part D and what it takes to enroll, we are actually going to spend some time going through that enrollment process and what it looks like on that side of it so that you have an understanding. This is something, if you feel comfortable at home, that you can do, or again, you can find a SHIC counselor, go to your area agency on aging, and we are glad to help you navigate the system and compare what it would look like for you. So when we go to www.medicare.gov, we're going to pull up that screen and you will actually get to see what that looks like. You are going to go, there's lots of things on here, there's lots of great information, but you are going to go to Find Health and Drug Plans. And when you click on there, if you are already enrolled in Medicare or you've got your Medicare card at least, so you're getting ready to start Medicare, you can use this bottom portion, which is the personalized search, and it's just that. It's going to be based on your zip code, your Medicare number. This is how we would actually go through the enrollment piece. But I'm not 65 so I'm not eligible for Medicare either. So I'm going to use the general search. And it's still going to give me the same information as the personalized search. It's just not going to give me that opportunity to enroll. So I'm going to do this first by zip code. It doesn't do us any good to enroll in a plan that isn't offered in our area. I live in La Crosse, so my zip code is 67548. I'm going to ask it to find a plan. That zip code extends into Ellis County as well as Rush County, so you need to select where it is that you are living, and I live on the Rush County side of things. It's going to ask you about how you get your original Medicare, and you can always say that you don't know. But we're going to assume that I'm getting original Medicare. We're going to say that I am not getting any extra help. Again, make sure you're clicking on things that pertain to you, and then we're going to continue into that plan result. It is going to ask for your medications. And we need to understand when we're talking about a drug plan that we are talking about making the best decision based on the information we have today. We understand that we could change medications partway through the year and that our plan may or may not cover them very well. But we are making this decision based on what we know today. So I've just selected a few medications. I'll say that I'm not actually on any of these, and I don't even know if these would be a combination that a doctor would assign. But as you start typing these in, they will come up and then you can select them. It will give you all the dosages that are available here, and it usually puts the button where it is the most common, as well as the quantity and the frequency that you get these. So maybe I want this to be a 90-day supply and I get that every 3 months. Right now I'm going to leave everything just for simplicity of that we're going to pick this up every month at a retail pharmacy. If you are getting this medication from a mail order pharmacy, you're going to be able to select that at this point in time. Mail order pharmacy does not mean that your local drugstore is mailing it to you. A lot of times we will see a mail order pharmacy for those that are on chemo and those very specialized medications that we're not going to get at our local pharmacy that are going to be mailed in. So we're going to put in several different things just to kind of get an idea. Again, you can change any of those frequencies. This is where it becomes very important that when you bring your medication list to us to go through and through the plan finder and find out your plan, that it's a very comprehensive. You can see that just because I'm taking the Levemir, I had multiple options. So which one do you have? What size of vials are they in? It is very helpful for you to bring the prescription itself, like bring the bottle, bring the packaging that it's in. Your pharmacist can also print you out a very detailed list, and all of those things become very helpful for us. Let's say I'm taking just those 3 medications. We're going to tell them that my drug list is complete. If you ever wanted to come back to this drug list, you can see that you have a drug list ID and then a password and the zip code. Not that you have to keep this. It's just one of those, if you wanted to pull it up and not have to retype in your medications, you could write that down and keep it in a handy place. Based on where I live, I have 2 options here for a pharmacy, and they're actually the same place. They're just changing names. So I'm going to say that I want to use the Rush County Pharmacy, but maybe I want to compare and see what my options are if I were outside and maybe a Walmart or a Dillon's. So we can expand our search based on the miles around. So let's say I want to use the Walmart pharmacy here in Hays. It will allow you to compare two pharmacies. So we want to continue on to our plan results. We're looking at just prescription drug plans. And you can see that there are 23 plans that are currently available right now to us in our area, and based on the pharmacies that we chose. So if I were on original Medicare, my medications, my cost of today, so this is October, November, and December in all honesty, I would need to expect that I would pay $2,210 out of pocket. This is if I chose not to have any not to have a drug plan. Then I can look down here, and these are going to be in order from lowest to most expensive. Many of your supplemental plans will choose to also offer a prescription drug plan, but it might not necessarily be in your best interest to use them. I'm just going to use Blue Cross and Blue Shield as an example. They offer a supplement plan. They also offer a prescription plan, but it may not be in my best interest to choose them based on the medications, and sometimes it is. So it's just one of those things that, again, we want to compare. Remember, it's a dance, and make sure that we're getting the best possible coverage for us. We're going to look at the top three things. It will tell you what our coverage is. One of the things to look at is, are all the drugs on our formulary? And we can see that yes, they are. We can see that I have no drug restrictions on this plan. I have no drug restrictions on this plan, but on this plan down here, there are some drug restrictions. So if I were going to go with that plan, I need to see what those are. Are they going to limit the amount of insulin I can have in a month? Any of those sort of things we'll need to find out. So I'm going to click on those first three plans, and I'm going to actually compare them. And this is where we can find out lots of information from them. First off, being an N, meaning they're a nationwide plan. If I'm somebody that likes to travel a lot and I forget my medications, it would be very easy for me to find a pharmacy that accepts this plan. That does not mean it needs to be the end-all be-all, though, for when we select a plan. It tells us what the monthly premium is. We can see that there is a variance between them. All of these plans happen to have no deductible, but what we really want to compare at is down here at the cost. So the cost at the Rush County Pharmacy, this plan is actually not, they are not accepting this plan, I'm guessing based on the cost here, is $2,301.75. Where if I took my prescriptions to Walmart on this plan, my cost is going to be $257.10. And this is simply based on enrollment today. So this is covering October, November, and December. And these amounts are including what you're going to pay for the drug premium as well as the drug cost. You can find out lots of information. We're not going to go into this really any deeper, but if you went further into here, you could see what the full cost of your medications are. If we scroll down, you can see that Rush County Pharmacy is considered an out-of-network pharmacy. So something that you can check with your pharmacy, but like I said, it comes up and shows us that they would be considered out of network, and this plan is not going to cover here. You can see what the full cost of the drug is, as well as what we would pay when it goes through the initial coverage, what happens when we're in the coverage gap, and what happens when we are in catastrophic coverage. Those are all things that we are going to compare and talk about when you come into an appointment, so that you can actually leave the appointment enrolled in the next plan for the next year. When we come back, we will talk more about Medicare Part D and some of the things you need to think about when you enroll.
Safety at a peace of mind price. Nex-Tech Wireless introduces the simple starter plan. For only $15 per month, you can rest easy knowing you can always reach your child on their smartphone. The plan includes unlimited calling, unlimited texting, and unlimited data while on Wi-Fi. You don't have to worry about data overages, and your child will enjoy all the benefits of a smartphone. It's the simple starter plan from Nex-Tech Wireless. Unlimited talk, text, and data while on Wi-Fi for only $15 per month.
Your house is more than just a house. It's a home for your family to grow. It's a place where you feel the most comfortable and can be yourself. Shop at Paul's Furniture Company in Selden so your family can select the perfect pieces for all the rooms in your house. With over 17,000 square feet of selection, they are sure to have the styles that will please everyone. even the kids. Visit Paul's Furniture Company in Selden, where they'll help you feel at home. Visit us online at paulsfurnitureco.com.
Here in the Heartland, we make things homemade with precision and care. Robin Insurance is no different. Their family creates tailored plans to keep your family safe. They are a family-owned and operated agency that also offers commercial, farm, and crop insurance. With quick, fair claims, your matter will be held professionally and with excellent customer service. Robin Insurance, the corner post of insurance since 1936. See their ad in the Nex-Tech directory.
The Rusty Tractor in Kensington offers big city dining with a small town feel. The Rusty Tractor features hand-cut steaks, burgers, wraps, and more, all with generous portions and quality products. The Rusty Tractor is proud to serve the area farming communities and welcomes everyone. Come as you are in your boots and jeans. You'll be right at home. Open daily and conveniently located on Highway 36. For more information, find them on Facebook, or for a full menu, visit rustytractorkensington.com.
Welcome back to this last segment as we talk about Medicare Part D. We've gone through talking about how we enroll and that there may be special times for us to enroll. We've gone through how it looks on the computer and what we're actually comparing when we go through the Medicare.gov website. And then we will finish up with some fraud, scams, and some other information that we need to know when it comes to enrolling in Part D. When we do use the Medicare.gov website, remember you do not have to come to a SHIC counselor to use it. If you are comfortable with using it on the computer and you enrolling yourself, you're more than welcome to. But know that we are available to help you and to help educate you and guide you and with that decision-making process. At the same time, we are not going to make those decisions for you. I don't know how many clients I get every year that say, "Oh, Erin, just make the decision for me. What would you do if this was you?" I'm not making that decision for you. I will give you some things to think about. I will help you go through what could be beneficial or detrimental to you. But in the end, it is you making this decision, about your health care. So as we finish up, we're going to talk about how we move through this Medicare Part D, because some of these plans are going to have deductibles and they can be up to $400 per year, and some of these plans may not offer a deductible, or maybe they offer a deductible that's different. But the maximum deductible that we can offer for 2017 is $400. We're going to take a look at the screen here, and this will show you the different ways that you move through Medicare Part D. Again, if you have a deductible, that's where we're going to start at, and it can be up to $400. And then you're going to be going into what is called that initial coverage, when the plan pays 75% and you pay 25%. And you're going to go through this part up until you have paid $1,225. That's the limit for initial coverage. And then we go into what is called the coverage gap, or the donut hole is what you hear people talk about. This is where the plan is going to pay for 49% of generics, 10% for the brand name drugs, and you as the enrollee are going to pay 51% of the cost of the generic drugs and 40% for the brand name drugs, up until we get to that limit of $4,950 of out-of-pocket costs. So this is something that can get very expensive depending on the medications that you take. Then we get into what is called catastrophic coverage. Catastrophic coverage being when the plan pays 95% and you are going to pay 5%, or $8.25, whichever one is greater, for brand names, and $3.30 when it comes to generics. So that is the way that we move through this benefit. Know that it is actually, you may change. You may start off and your drug coverage, it may be one price, and then as we get partway through the year, as you've spent more money, you're going to go into that initial coverage, and then you're going to go into the donut hole and maybe even get into catastrophic coverage before the end of the year happens. So know that we have some changes throughout the year. So there can be some price changes when you go to the pharmacy and pay for your medications based on where you are going through this. One of the things that we need to understand is that very few times will I ever counsel a couple and they have the same plan. Okay, remember, we're all about finding the plan that is best for you based on the formularies that they have and based on the medication needs that you have. So a lot of times I have couples that are going to have a different plan, or many times I get the coffee groups. This is not unusual to get a phone call when I have a whole group of them at coffee and they pass the phone around and they ask the questions and they go, well, my friend is on a Silver Script plan or a Humana plan and she just really, really likes it. Don't you think this would be the best plan for me? I really think I should sign up for it. And that's where we have to say, whoa, let's hold the horses. Let's see what is best for you. We need to compare. I definitely have some coffee groups who understand the importance of coming in and comparing. So now it's a race to see who comes in and gets their comparison done, because this is really where us as consumers can save money by changing plans, especially when those plans do not offer what you need. I had an individual last year who, had she stayed on the plan, it was going to cost her about $10,000 because they weren't going to cover one of the medications that she needed. And by switching her plan, we saved her almost $10,000. Not saying that everybody we're going to save you $10,000. Sometimes it's only $50. Sometimes there's not even a change whatsoever. But we need to understand that this is a great consumerism piece that we can hopefully keep some more dollars in your pockets and in our communities. So if we need help paying for prescriptions, and how do we get that? You can apply for a low-income subsidy. You can apply online at Social Security. Many times our SHIC counselors will help you. So if you wanted to come into my office and we needed to apply for this, understand that there are income guidelines, and for 2016 that means that you make under $17,820 of annual income, or $1,485 for a single policy. And then it changes those for couples, and we look at your assets as well. So your assets are going to include those savings, those CDs, if you own multiple homes or multiple vehicles. However, you can have one home and one vehicle and it not count towards your assets. This is where a lot of times we really have to think about those that are farming. It does not count your home and the ground that it sits on. But if you own that 40 acres across the road, or in another part of the county, those are all going to be considered assets. But those are things that we need to talk about when we're talking about whether or not you're eligible for extra help. As always, we need to be aware of scams and frauds, and understanding that they cost us U.S. taxpayers billions of dollars every year, because scammers can steal your identity, trick you into bogus deals. They can put claims on your behalf, so we want to be very careful when we do this. This means treating your Medicare and your Social Security number with care. And biggest thing to remember here is that Medicare will never call you and they'll never visit you. They are always going to use the postal system. So yay for keeping our postal system alive, but they won't call, they aren't going to come to your home. Make sure that you record those doctor's visits and the medications that you are taking, so that when you get that benefit statement back, that you really did receive what it said that you were supposed to get. As always, we need to remember that Medicare is a health insurance program and it's not going to cover all of your costs. And we saw that on the Part D here, that you're still going to have out-of-pocket costs when it comes to it. But in the end, we need to make the right decisions at the right times and come and get help if you need it. Medicare.gov, Social Security, Kansas Insurance, all of these websites, there is also the phone numbers provided for you, are all great resources to get you help that you need. Again, making sure that you call, come into our offices, ask. If you have a question, there is an office phone number for me as well. If you need more help, or you need to get some help finding a SHIC coordinator for you, I would be happy to help you with that. And I wish you the best of luck. And remember that Part D is a dance, and we need to look about switching our partners every year from October 15th to December 7th.